Hello, everybody. This is Dr. Kamel again, and a new content related to the physical therapy examination, preparation for physical therapy examination, especially BT license. So, if you didn't see any of my videos before, my name is Dr. Kamel, and I work as Associate Professor of Physical Therapy in the United States, and I'm a licensed physical therapist in the United States across several states, also in the UK and in Egypt. I have got my PhD from University of Nottingham in the UK. So let's dive into our today's content. A physical therapist is designing a trunk strengthening program for a patient with osteoporosis to help reduce the risk of vertebral compression fractures and other complications. Which of the following trunk movements should be prioritized during strengthening exercise? We know that, some people they get osteoporosis, and we know that there are some risk factors for developing osteoporosis, maybe female after menopause, so old age after menopause, because of lack of estrogen and other factors. And we know that those people who have osteoporosis, and we talked about osteoporosis before in several other contexts in the way of how to diagnose osteoporosis, how to do some investigations like DEXA scan for osteoporosis, and how we can read them and so on. So some people who have osteoporosis, they are susceptible for vertebral compression fractures. And we know that vertebral compression fractures, the vertebrae, the anterior and the posterior height of the vertebrae should be equal, but if the vertebrae is compressed from one side and the height is reduced, we call this wedge compression fracture sometimes, or vertebral compression fracture. Okay, so when we are designing trunk movements, which one we should prioritize during strengthening exercise? Option A, trunk flexion. Option B, trunk rotation. Option C, trunk extension. Option D, trunk lateral flexion. Let's look at the answer. The answer is trunk extension. Okay, so why? Patients with osteoporosis, which is a reduced bone density, we have what's called osteopenia. Osteopenia, it is the status of reduced bone density, which is just before osteoporosis. It can be managed, and it is before osteoporosis. So there is a reduction of bone density, but we didn't reach yet to osteoporosis. But in osteoporosis, there is a decrease in bone mineral density, and these vertebral bodies will be susceptible to compression fracture, especially where in thoracic spine. So this is the most common area. Okay. So why trunk extension is the best? When we strengthen spinal extensor muscle like erector spinae, this will help reducing thoracic kyphosis. Okay. And thoracic kyphosis is common in patients with osteoporosis. Not only that, when we're strengthening the trunk extensors, we are also improving postural alignment, decreasing anterior vertebral loading, and all of these factors will reduce the risk of vertebral compression fractures. Okay, so again, extension exercise will encourage a bright posture. Okay, and this will lead to distribution of spinal loads more safely, and then maybe reducing the risk of vertebral compression fracture. Okay, so these are the answers, but let's look at the incorrect answers here. Trunk flexion. Trunk flexion will increase the anterior compression forces on vertebral bodies. Okay, And this is associated and strongly associated actually with vertebral compression fracture in patients with osteoporosis, trunk rotation. These twisting motions will increase the shear forces and shear stresses on the weakened vertebrae, which will increase or might increase fracture risk. How about trunk lateral flexion? This will create asymmetrical, means unequal spinal loading, which might stress weakened vertebrae on one side. Okay. This was a question for today. Very simple, but we need to think about which exercise is safe, which exercise might be contraindicated, and might be increasing the risk of complications. Okay. If you would like to join my BT license preparation course, please send me a message on WhatsApp numbers 0014422487206 or 00201027743702, and I will send you all the details about the course. Usually people who are joining my course is people planning to take the BT license exam either in United States, in Canada, Australia, and in Egypt. And if you would like also to apply and join the post-professional or transitional DBT program at University of Montana in the US, which is offered at a discounted rate, please also drop me a message on this WhatsApp number and I will send you the details. One more note, that joining a program for DBT, this is for graduates for physical therapy program who finish their bachelor degree and their training or internship year. It is not for students, and this should be obvious. But sometimes I get inquiries from students. They don't understand that this is a doctoral degree or a transitional DBT program, and this is like a postgraduate program. It is not for undergraduate students. For the license preparation course, it is available, and I will send you the details. Thanks for watching my videos, following my content, and please share the channel with your colleagues. Will be much appreciated. Thanks, and see you soon in a new content.